Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. And today, we're joined by Yvan Baker, member of the House of Commons of Canada. Yvan and I are going to talk a little bit about some of the issues that Canadians are dealing with in terms of healthcare and some of what Member Baker is doing to address Canadians' healthcare needs.
Great. Well, I'm excited to have a listen.
Well, welcome, Mr. Baker. We really appreciate your being here. It's an exciting bio that you had. You're so young. Before we get into a discussion a little bit about Canadian healthcare and what you're doing to improve the lives of Canadian citizens vis-a-vis healthcare, could you just tell us a little bit about yourself, a little bit about your background and why you decided to pursue public service?
Yeah, you bet. Well, Stephen, first of all, thank you very, very much for having me. It's a real honor to be on the podcast. I am the Member of Parliament for Etobicoke Centre. Etobicoke is a suburban community in the western side of the city of Toronto. And so I represent a community of about 120,000 people in Canada's Parliament. I'm with the governing Liberal Party. I'm a member of the Standing Committee on Finance, and I chair something called the Canada-Ukraine Parliamentary Friendship Group. And in the last few years, that particular group of MPs and senators in Canada has played an important role in trying to support the Ukrainian people in their fight against Russia's invasion. So I've taken a lead on that. Prior to this, I was a member of provincial parliament for the same community in Etobicoke. And prior to that, I was a management consultant. I worked for the Boston Consulting Group. I spent some of my time with BCG in Toronto, a little bit in New York as well. And I also had the chance to teach as part of the MBA program at the Schulich School of Business at York University here in Toronto.
That's interesting. Just to get into healthcare, what is your current interest in healthcare? And if I may ask a follow-up, what led you to an interest in healthcare?
You know, I ran for office because when I was a management consultant, when I was in business, when I was doing my university studies, I would often, as many people do, volunteer for various charities or nonprofits that try to make a difference for folks on a range of issues. And one of the things that I realized pretty quickly as a volunteer is that on so many of the issues that I cared about, it was really government that had the ability to make the greatest impact in solving those problems. And so that's really what led me to volunteer into politics, get involved a little bit, take an interest, and then eventually run for public office, first as a provincial representative and now as a federal representative. So in terms of your question about healthcare, first of all, my family has a philosophy that there are a few things in life that are more important than health, that without health, there's really no happiness. And in Canada, we have a universal healthcare system. So government plays a particularly important role in the quality of healthcare and therefore the quality of life that people have. And when I started running for office, when I was elected to office, I interacted with hundreds, thousands of people in my community. And what I would hear from them consistently were concerns, views, suggestions, advocacy on the issue of healthcare, what we could do better, how we could improve the quality of healthcare in this country. So those are really the key reasons that I took an interest in healthcare. It's something that's really important to folks. And it's something that the government of Canada can really impact significantly because of our universal healthcare system. And that's really why I've spent a lot of my time on that issue.
There's something you said, I'm going to butcher it, so apologies, but it's something that we talk about a lot. Something to the effect of there's no entity that can impact as many people's lives as government. When government decides to put its full weight behind something, whether it's in the field of healthcare, the environment, sanitation, whatever the case may be, there's really no substitute for what a government can do with the right resources. And it's so true what you said. And we talk about that all the time on our show, on our podcast, which is why it's so important for patients to advocate to their governments for improved healthcare and to improve their lives.
Yeah, absolutely. I think that's true in most countries around the world. And I think it's especially true in places like Canada, where, like I said, we have a healthcare system that is universal. There are gaps in that system, but it is, broadly speaking, a universal healthcare system. Canadians have come to rely on the healthcare system that is provided through the single payer system that we have. And so the beauty of a universal healthcare system is that there is universal access for most sort of essential healthcare services and needs. But the flip side of that is that when a patient is dissatisfied with that care, whether it's the quality of care, the accessibility of that care, the speed of accessing that care, then the solution, very rarely can they simply pay out of pocket and resolve that problem, as you might in different healthcare systems around the world. The onus is on government to address that, whether it's a doctor shortage or a specialist shortage or the quality of care. And we can talk about that more if you'd like. So to your point, government plays an important role, but it's a particularly important role in the context of healthcare in our country.
Yeah, you talked about the gaps. Not all basic needs like eye care or dental care are covered completely under most universal healthcare systems. Can you talk about efforts being made to fill some of the gaps in Canada?
Yeah, absolutely. So you nailed it, right? Our universal healthcare system has gaps in it. And that's common to, I think, most universal healthcare systems around the world. What I would say for the benefit of your listeners is I would say that in Canada, the way I think about it is essential care is covered. Things like hospital care, emergency care, family doctor, essential tests and screens and procedures and those sorts of things. And elective and non-essential care is not covered. But there are gaps that in some of those areas of what I would consider essential care. So there are services that aren't covered. You talked about it. Dental care, eye care, until recently have not been part of the universal system. There are also procedures that are considered important, but perhaps not as critical, not as urgent, and are sometimes, depending on risk factors and other factors, cost factors, may not be covered for some folks. And sometimes people face delays in getting services that are essential. So that essential service may be covered, but you may have to wait months or even years in some cases to receive that care if it's not urgent. So those are some of the gaps, I think. Going back to your question in terms of what's being done to address it, I mean, first and foremost, what we're trying to do is make sure that those services where there are those wait times, that those get shortened. In Canada, the healthcare system is actually the jurisdiction of the provinces, and the federal government provides a lot of the funding for healthcare. So it is something that the provinces own and execute and have jurisdiction over, but the federal government plays a big role in. And what our federal government has done over the last few years is said, we want to plug more of those gaps in the healthcare system. One of them is dental care. And so that's one of the areas that, I'd love to talk to you about more if you're interested. But we're doing a bunch of things to try to make sure that we're also improving the quality of care. One of the things I'm proudest of as an MP is, as an MP, you're an advocate. You're trying to get the government to do things better. And I'm not the one who makes the decisions, but I certainly try to advocate for those decisions to be made. And one of the things I'm proud of is that I was one of the MPs who fought very hard successfully to convince the government to tie funding that we provide to the provincial governments, that the federal government provides to the provinces, to results. So instead of sort of just cutting a check every few years for healthcare and giving it to the provinces and saying, off you go, spend it as you see fit, let's tie that to certain outcomes for patients, whether it's access to doctors or certain care providers and those sorts of things. But obviously the biggest thing that we're doing in terms of plugging gaps is the creation of the New Canada Dental Care Program. It's the biggest expansion of healthcare, of the universal healthcare system in Canada since the inception of universal healthcare in this country.
Can you describe what that entails, what the current plan provides, and what you're hoping to achieve?
Currently, if we take a step back, in terms of dental care, we know dental care is so important to people's broader health. It's not just about their oral health, but you spend a lot of time on your podcast talking about chronic illnesses. And, and I have to say that, dental care, if I think about your listeners who are experts, who are patients, others concerned about chronic illnesses, I've got to believe that for them, dental care is something that they value or could see value in as a preventative measure to prevent some of those chronic illnesses. But the plan for the dental care program is basically that people who have a family income under $90,000 and don't currently have private dental insurance will qualify for the program. And virtually all essential dental services, oral care, will be covered. So preventative services like scaling, polishing, diagnostic services, restorative services, prosthodontic services, removal of dentures, deep scaling, oral surgery, the list goes on. So we're really covering a pretty comprehensive set of services. And it's specifically targeted at those who have family incomes under $90,000 and don't currently have private insurance. The reason this is because the goal here is to prioritize those folks who currently aren't accessing dental care because of the cost of dental care.
You said it beautifully. Dental care is healthcare. What goes on in your mouth really affects your entire body. So it is important not to neglect dental care, and it really should be part of more comprehensive healthcare around the world, not just in Canada. So that's fantastic. You're also doing a lot of work to strengthen support for seniors. Can you share why it's important for you to devote so much time and energy to senior citizens?
There's a number of reasons. One is because I think that seniors play an important role in my community. They play an important role in our country, in communities that your listeners are in. But I also think that they have contributed a lot, and we owe it to them to provide them with the best possible quality of life that we can. And healthcare is an important component of that. I work a lot with seniors because I also appreciate the wisdom and perspective that they offer on whether it's issues of healthcare or things that touch them or things that touch people of all ages and backgrounds. In my community, we have one of the largest proportions of seniors in Canada. So I have a lot more seniors than most of my colleagues who are members of Parliament. And so seniors issues are of particular importance to me because that's what's important to my constituents. But also going back to our earlier conversation, Stephen, we were talking about the role of government. And again, when we think about what I hear from seniors a lot about is issues like healthcare, like housing, like transportation. And those are things where government can really move the dial in terms of the quality of life that seniors enjoy. Pensions is another one. So these are some of the reasons why I spend a lot of time working with seniors. I hold a monthly seniors advisory group meeting where the purpose of these is really to hear from seniors about what's important to them, answer questions, take advice on how we could improve. And, we were talking about dental care a moment ago. I've been elected for almost 10 years in public office. And, dental care was one of the first things I started to hear from seniors about, not just for the medical benefits that we talked about, but just from an affordability perspective. I know a lot of folks around the world, a lot of your listeners in different countries around the world are struggling with inflation, cost of living. My constituents are, whether it's housing or daily cost of living. And one of the expenses that touches seniors the most is those dental care expenses, especially when there's unexpected need for dental care. Some have insurance through their pensions programs or through private means, but very often the most expensive services have to be paid for by seniors out of pocket. So in all those ways, this is why I work with seniors. They deserve the support. We need to support them. They're a large percent of the population, but also government can really impact their quality of life.
Well, first of all, it's fantastic, all the work that you're doing on behalf of Canadians, and particularly your constituents. And with that, I just want to wrap up by asking, let me just say, a lot of what we do here on the podcast at GHLF is to encourage patients to share their stories with elected officials. Can you talk to us as an elected official about what it's like meeting with constituents and why patient voices matter?
When I first got elected, Stephen, my predecessor as the representative for the community, as the member of provincial parliament, gave me a piece of advice. She said to me, a lot of people see their elected officials speaking at a speech, at an event, maybe on a podcast, and we kind of get accustomed to thinking that politicians are there kind of to talk, to communicate in some form. And that's certainly part of the job. But she said to me, the most important part of a politician's job is to listen. Because when you listen, you understand what people's priorities are, what their concerns are, but you also hear the ideas that you need to solve these problems. No member of parliament, no congressman, no representative has the solutions to all of the problems that people are facing. And so to your question around why it's so important to hear patient voices, it's kind of for those reasons, right? Like whether you live in a country with a universal healthcare system or you pay privately or a combination of both, the reality is that whoever's responsible for that healthcare system is only going to improve that system if they know what those problems are and if they're motivated and held accountable to solve them. In the case of a universal healthcare system like the one we have in Canada, it's the elected officials at the provincial and federal level who are accountable for the quality and the services that are provided. Even if you're not in that situation, I think it's important that patients are communicating what's working, what's not working for them, and pushing the healthcare providers, the people responsible, to make sure that we improve that system, because there is no happiness without healthcare.
Wow, I want to tattoo that somewhere. Not on my body, though. There is no happiness without healthcare. I love it. I love it. Well, with that, thank you so much, Mr. Baker. We're so appreciative for all that you're doing, and thank you for taking your time to come on the show.
Stephen, thanks for having me. It's been an honor.
Well, Stephen, that was a really great discussion with Yvan. It's interesting to hear about, what issues crosses the borders, and just a reminder that it's always important to hear from constituents.
Yeah, absolutely. Like you said, for me, it's always instructive to talk directly with elected officials and to hear from them. And it's fantastic when they tell us how important it is to hear directly from their constituent patients. So with that, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.